Hello, Dr. Ahmed. I am Muhammad Abul Khair. I will talk about to case number 2 in the clinical pathology. The case, a 1-year-old female Havana cat was referred with a history of recent anemia, BCV bacterial equal 14%, documented 2 weeks previously. The cat was living with 4 other ornamental cats, mainly indoors. Vaccination against calicivirus, herpes virus, panleukopenia and feline leukemia virus and deworming was up to date. The examination findings unremarkable. Temperature 39.1, heart rate 160, respiratory rate 13, the body condition score 4/9, weight 3.8 kg. The following tests were performed: hematology, biochemistry, COMS test, urinalysis, infectious diseases, coagulation profile. The test results indicate mild hypochromic normocytic anemia with evidence of bone marrow response, suggesting hemolysis or internal bleeding. The negative COMS test provides no strong evidence for an immune-mediated cause. There is a slight elevation in white blood cells, particularly neutrophils and monocytes, indicating inflammation. Mild increase in ALT, alanine aminotransferase, and blood glucose may be due to stress or mild liver damage. A slight increase in pre- and postprandial bile acid suggests hepatic dysfunction. Through other causes like pancreatic or gastrointestinal disease cannot be ruled out. Feline leukemia virus, feline immunodeficiency virus, and mycoplasma tests were negative, ruling out chronic infection. A positive feline coronavirus antibody result is not significant without additional symptoms. Coagulation profile is normal. In this figure, hepatic aspirate. The irregular pink amorphous material dispersed between the cells is consistent with amyloid, an abnormal protein that accumulates in tissues. The findings suggest hepatic amyloidosis as the underlying issue, leading to liver cell damage due to reduced blood flow and amyloid build up around vessels. This explained the elevated ALT and bile acid. The amyloid may have caused internal liver rupture and abdominal bleeding, which likely lead to the anemia. Since the bleeding is internal, no external source is seen. The inflammatory blood profile may also result from this internal hemorrhage. Local liver inflammation remains possible but may have been missed due to limitation of liver aspiration. A liver biopsy is recommended to confirm amyloidosis and assess severity. In this case, the biopsy confirmed hepatic amyloidosis with localized bleeding and mild liver dysfunction. Amyloidosis is rare in cats and can be secondary to chronic disease or genetic in origin. It involves deposition of amyloid A protein, especially in the liver or kidney. In abyssinians, it affects the kidneys. In Siamese, Oriental and domestic cat, it mainly affects the liver. causing rupture and bleeding. The diagnosis: anemia, inflammatory leukogram, hyperglycemia likely related to stress, hepatocellular enzyme leakage, and decreased hepatic function associated with hepatic amyloidosis. No confirmed treatment exists. Throxetine used in human or dog was offered but declined in this case. Thank you, doctor.